Recording. Grüß Gott und herzlich willkommen beim Bürgertreff Gesundheit Hannover. Today in English, welcome to a new episode in our series Healthy Nutrition and Orthomolecular Medicine. We have a rather famous guest from California, San Diego, Dr. Joel Fuhrman. Dr. Fuhrman, greetings from Germany.
Thank you. I'm excited to be here and look forward to speaking about all this fun information to all of you people in all over other parts of the world. This is so exciting.
Very good. I will take the desktop for support, which is to show the people watching this. We have a playlist. At the moment, 106 videos, not all about Dr. Fuhrman, but most of them. The first video is a video I made today for introduction to the work of Dr. Fuhrman. So I sort of outsourced the introduction, talking about who he is, what he does. We will talk about his books. We will talk about his role with the rather famous Joe Cross movie. And we start with this guy. And that is Dr. Herbert M. Shelton, naturopathic doctor. I believe, Dr. Fuhrman, you have a story to tell when you were a teenager about the influence of the rather famous Dr. Herbert Shelton in your family. Could you tell us the story?
That's correct. I mean, I think that Dr. Shelton was my introduction to this field of natural medicine. And I read all his works, all his books, all his Shelton hygienic reviews in the 1950s and 60s. So my father was overweight and sickly and had osteoarthritis and other issues. And he found out about Dr. Shelton's work, then called natural hygiene, and started changing our family's diet when we were teenagers and changing his diet. And he lost weight and got a lot healthier too. So that was my introduction. And I did find the work fascinating, and it gave me an understanding that we don't have to be sick, and that what we eat really controls our health destiny, contrary to the conventional view of common, what's socially accepted in society. That when you get sick, you expect doctors to get you well, and you think medications are going to help you. And it gave me that critical eye to think that medications can harm people and can cause damage, and they don't address the cause of what made the person sick to begin with, and the cause can be addressed through nutrition. So it became the foundation of my study, and I continued, of course, on this path to become a specialist in nutritional medicine, spurred on and motivated by Dr. Shelton's works.
I believe, looking into Dr. Shelton's work, that the G-bombs was already there in status nascendi. Would you agree?
I don't know. I don't think he isolated the G-bombs per se. I think
per se, but what he was doing was he was talking about greens, he was talking about beans. I don't know about the onions and the mushrooms, but certainly about the berries and the seeds. So the starting point for the Nutritarian lifestyle, one could argue Dr. Shelton is one of the forefathers of your Nutritarian lifestyle.
Absolutely, I agree.
Do you remember in the film of Joe Cross, there was the juice fasting, the vegetable juice was a rather important role. Do you remember the fasting of Dr. Shelton was originally water fasting, right?
Dr. Shelton, yes, he was a big, he really was mostly had a retreat in San Antonio, Texas, where he water fasted people for long periods of time. So yes, they were the natural hygienists in those days, very heavily into fasting. Some still are today, and water fasting obviously has its role. But I think that it can be. There are cases where they fast people too long that can put people at risk as well. In those days, they took a lot of risk with people, and in my opinion, fasted people dangerously too long in many cases.
Do you know? When I was doing the research about Dr. Shelton, his rather intriguing role to bring the British Empire down. The British Empire was failing because in sort of an interpretation of Dr. Shelton. Do you know the story?
No, I don't. Not at all.
Mahatma Gandhi was a pupil of Dr. Shelton by reading his book.
Really?
And you do know that the fasting of Gandhi is, one could argue, one of the main factors that the British gave up. So if you follow that argument, Shelton is responsible for the fall of the British Empire.
That's funny.
Okay, now there was an interesting part. I take the desktop again. There was an interesting thing I didn't know before I did this research. The education Dr. Shelton got was in a college in New York about naturopathic medicine, which was run by Benedict Lust. And Benedict Lust was a pupil of Sebastian Kneipp in Germany. So one could argue the European tradition via Sebastian Kneipp, which was a priest, goes directly into the Dr. Fuhrman nutritional health lifestyle. How do you like that?
It's funny, you know, I always say I'm more of a naturopath than the current naturopaths. Many of the naturopaths today still have a remedy mentality, looking for some either medicine or natural medicine instead of really focusing on the cause of disease and getting people well through the basics of nutritional excellence, which is so much more effective. So, you know, I have an extremely naturalistic type orientation for sure.
In your Nutritarian lifestyle, the way you developed it, is there a naturopathic medicine touch of it, or is your approach basically nutrition and supplements?
No, my approach is I make the effort to almost everything I do to be supported by an overwhelming scientific evidence. This is a definitely science-based nutritional program. So I think in the last decade, there's been an avalanche of scientific information documenting lifespan enhancing properties and anti-cancer properties of green vegetables and onions and mushrooms and flax seeds and chia seeds and all these foods, onions and scallions, all these foods we're telling people to eat have an overwhelming amount of science. And the foundational principle of the Nutritarian diet is the most proven methodology in the history of science to slow aging and prolong human lifespan. And that's moderate caloric restriction, not excessive caloric restriction, in the context of micronutrient excellence, which means of getting, and that doesn't mean just the amount of nutrients of phytochemicals and antioxidants and beneficial nutrients, but also a wide variety, getting the full rainbow of nutrients available in the natural kingdom that humans can benefit from, making sure no nutritional input is missing that could be important for the prolongation of human health and lifespan. That's where the original natural hygienists and naturopaths went wrong, is because a lot of people develop serious problems, either from first B12 deficiency and vitamin D issues, but then really from DHA deficiencies, where the leader of the natural hygiene movements that I was familiar with as my mentors when I was young, all either developed dementia or Parkinson's or other neurologic problems later in life, most likely from DHA deficiency. Because I knew them and was the medical doctor caring for a lot of this elderly community of natural hygienists and vegan health seekers, I was drawing their blood and being aware of severe omega-3 deficiencies in these people that develop these neurologic problems. So I became much more cautious in advocating that natural food diet without paying attention to make sure you're getting everything you need. And if it needs a supplement, then you make sure you supplement in those things that the diet might be low in. And we're talking here mostly about DHA because that was the major factor that caused these problems to develop, where Dr. Shelton himself died of Parkinson's. Kiki Sidwa died of Parkinson's. Other leaders in that community, I know some of them I can't mention their names, died of Parkinson's, and many of them, including Dr. Shelton's sidekick, Virginia Vitrano, got dementia, as did a lot of these people who were my favorite people and people I loved and cared about, who were following a super healthy natural diet, but weren't taking care of the fact of making sure that they were getting every nutrient that we need available to them.
We at the Bürgertreff Gesundheit Hannover, we do a unpaid telephone coaching, which is ehrenamtliche Telefonberatung. And we have two requirements. One is the 25 OHD level of vitamin D has to be above 60 nanograms per milliliter. And we only do the unpaid coaching if the people have completely read this book. How do you like the embassy for your Nutritarian lifestyle in Hanover?
That's so exciting that you're using my work in Germany and in Europe. I'm very proud of the fact that many teachers of nutrition and many medical doctors and many scientists use my work, use my books, and use my studies on hunger and food addiction and the changing. And so a lot of that and a lot in America, the American College of Lifestyle Medicine, a lot of those lifestyle medicine doctors, you recommend my books to their patients and have learned from me. So I'm very proud of the fact that I've helped spur a new generation of health professionals that have learned a lot and gone on to help other people. So it's like a snowballing effect of more professionals that are now helping people with natural methods and helping people get better.
Going back to Dr. Shelton, your father and your experience with a more healthy lifestyle, you and your sister were rather famous for ice skating records. I believe you nearly made it for the Olympic team, but then you had a sort of accident, is that right?
That's right. I was second in the United States in 1973. In 1974, we were the #1 ranked pair team in the United States, and I toured Europe. I competed in Germany, and I in France, and I was competing in the World Championships in Czechoslovakia, and then in Spain. But yeah, so I was a top-ranked competitive figure skater, and then got hurt badly in this right before so I was on crutches a long time and did that fast. So I really couldn't get back in good enough shape again to get into the 76 Olympics. So I did not. So even though I was ranked #1 in 1974, after the team above us quit and retired, so we were #1 in line for the title. We were second in 73. That team retired. But then unfortunately, I could not make the 76 Olympics in time.
Was it an accident on the ice or in normal life?
No, it was an accident on the ice. It was
Okay. And then the story goes that you, because of your knowledge of Dr. Shelton's work and of the surrounding organizations in the United States, you sort of got a treatment which was unorthodox, one could say. Is that true?
Well, I fasted a long time to help facilitate my heel bone. My calcaneus pushed through the bottom of my fat pad, and I probably had some calcifications there. So I thought that it wasn't healing right, so I thought that fasting might aid the healing. I don't know for sure, but I know that it eventually got a lot better. It never became a normal heel. I didn't ever become a foot that can take impact, so I had a real cushions under it and things.
But on the film list, on the video list I showed before, there is a short video on your YouTube channel showing you later on ice skating. Is that right? That video was.
Yes, after I got my strength back and got in better shape in 1976, after the fast, I was then third in the world in pairs figure skating, a professional competition held in Jaca, Spain. So I did skate after that and perform after that, after my heel injury. That's correct. So I built back my muscle tissue and got back in shape again. But being out of commission for over a year and that long fast really weakened me for a long time. So I couldn't get my full strength and stamina back in time for the Olympic tryouts, because it was held in Colorado Springs at high altitude. And then I continued to get in better shape after the Olympic tryouts, even and doing better, but not in time for the Olympics.
And always with your sister?
Yes, with my sister, my younger sister, correct.
Okay. How many days fasting did you do? Jesus fasted 40 days, you did more?
Well, I fasted first 10 days in my house in New York, and then I ate for a week, and then I flew to Texas to be in Dr. Shelton's health facility, and I fasted there another 36 days.
So that's 46 days, that's more than Jesus.
46 days on water, and it really was, it almost was, it could have been life-threatening. It was very dangerous to fast that long, and I was only 19 years old at the time, or 20 years old at the time. So I look back at it and I almost think my parents shouldn't have let me do that, because it was too extreme, and it was a little bit, and it did have, it was quite dangerous, and no way would I advise that. And I think it even hurt me in a lot of ways. It hurt me fasting that long.
The water fasting gurus in my country, in Germany, they report that the first 14 days is normal, and then there is a sort of elevation of spirit and mind. Did you experience that after the 2 weeks?
No, I would say that I got so weak I could hardly roll over in bed from my left
Oh,
side.
okay. Okay.
And
So the peak experience was not in your life with 14 days of fasting, water fasting.
fasting was comfortable, but then it got to a point where I think that the fasting, the naturopaths and chiropractors and doctors who fasted people back in those days, I think were too cavalier and extreme and
Okay.
fasted for too long to the near the point of death. And I
Yes.
think
Okay.
it caused permanent heart problems and heart arrhythmias and difficult, and it's too risky, and people should not be fasting like that. Even though I did it and I survived, it didn't. It wasn't something I would recommend anything near doing like that today.
Right. And was there any parallel therapy, swimming, treading of hot grass, cold grass like Kneipp or anything like that? Or was it just water fasting and that was it? The whole therapy was just water fasting, or was there something more?
I was just lying in bed water fasting. I could not walk at that point. I was too weak and couldn't,
Okay.
and I had to walk for a long time before I started the fast with my injury. And
So,
so
in your own experience, you're an expert on water fasting and what should not be done. Very good. Now,
no, that's not true. I water fast people with short water fast to help them with certain things like ulcerative colitis, rheumatoid arthritis, and asthma. But no way do I recommend fasting that huge amount of length of time.
Yes, yes.
You know, fasting. It's okay to fast 5 to 10 days for people for therapeutic purposes. But but once you've lost your antioxidant reserve and your glutathione is gone, and then you're not going to get much benefit from fasting until you're a skeleton, and a skeleton.
Okay.
Better to eat again and fast again if you have to. And then fasting is also not compatible with certain medications. So I'm much more cautious, but I'm not saying it doesn't have value.
So you're back on the ice skating and you're good at it. Now, what about the profession? What did you do for professional life? You went to college, I suppose?
I went to college while I was an ice skater in the early 1970s. So the time I competed in the 1976 World Championships, I was already out of college by then. And then I coached skating, and I worked in my father's shoe business. He had 10 orthopedic shoe stores in New York City, and I fabricated orthotics and worked with making custom shoes for the New York City hospitals for people with injuries too.
And that college you attended, what subjects did you take?
Well, I went to NYU as an undergraduate, as an economics major with a lot of other courses I took. And that was during my skating career.
Yes.
I went back after I decided to become a physician specializing in nutrition. I went back at the age of 28 to take the postgraduate pre-med course at Columbia University. And then I took the pre-medical sciences and calculus and physics and all those advanced and all those courses to then take the MCAT, which is the test to get into medical school. So I didn't take the science courses till I was older.
So in some of your videos, you're telling the story how this came about, that you became a doctor. That was not your original decision. Somebody influenced you, right?
Yes, I was thinking about it in the back of my mind of dabbling in it, but until I really met I met my wife, but she wasn't my wife then. We started to date and to talk, and she was going to medical school, and she really helped me a lot because she said, if you're so passionate about this and this is your love and your interest, why don't you do it? Why don't you pursue it? And I said, well, I thought I'm too old, and I tried to go back, and I don't have the coursework. And then she really said, well, you can just drop everything, go back full time. You can get it all done in like a year and still go back to medical school. It's not going to be years and years of forever. So I said, oh well. So I decided, as a result of those conversations and my wife's influence at that point, before we were married, of course. And then, of course, we got married. But then I told my father I was retiring. That I would leave the shoe business and he would sell it and he would retire, because I was running most of it then. That I would go back to school and he would be able to sell the business and retire, and I would pursue a different line of work. And so we actually sold the chain of shoe stores before I even went back to Columbia for the courses to go to medical school.
So how do I have to visualize this? You're going to a medical school, which was a normal medical school, classical style, Rockefeller Foundation, against naturopathic medicine, suppressing naturopathic medicine. And you are one of those very few medical students who has something in a vision of nutritional medicine, which is definitely not what these schools teach. Were you an undercover agent, or did you speak openly about it?
I definitely spoke openly about it, and they actually made me the chairperson at University of Pennsylvania School of Medicine of the Nutritional Education Committee. And then they put me on the school's admission committee. And they even, yes, they actually paired me up with other people and other researchers and doctors who had interested in nutrition at the school, so we'd have a little group where we could communicate with and get support from. And I would write papers on nutrition in medical school, and they would be critiqued, and we would just have discussions about them while I was in medical school. They would really encourage you to pursue your interests, and had little groups and people who get people together who had similar interests. So it wasn't taught formally in the school system, but certainly they definitely encouraged you to develop a high degree of expertise and excellence in whatever field of study that you saw that you were interested in.
But considering the fact what you nowadays represent, the Nutritarian lifestyle, is a really big threat to the sugar industry, to the milk industry, to the egg industry, to the dairy industry, to the pharmaceutical industry, how come that they didn't realize how dangerous you are?
And a danger to the drug industry, the
pharmaceuticals. Yes, pharmaceuticals, yes.
And medical and surgical and hospital industry,
yes.
The whole medical pharmaceutical complex.
How do you explain that they didn't realize how dangerous this guy is?
Yeah, I guess that there's such a growth of sick people with the explosion of the fast food, fast food and processed food revolution. There's enough sick people. I knew, and a lot of my friends were nephrologists, and they used to say, "Get all these people well. We have too many people that we can't handle already. We gotta
okay.
We don't need more patients. There's so many people coming in sick, and so many people who are straining our system, and we're working so hard. It's not like doctors want to keep people sick, or what I'm saying is that there's so many sick people eating poorly that it's nowhere near the amount of people living healthfully is putting these people out of business yet. You know what I mean?
Yes. So 1989 is your exam, right? Medical exam?
I graduated from medical school in 1988.
1988. That is, so you are a contemporary physician of Professor Dr. Linus Pauling and Irving Stone. Did you hear from their approach in these days when you studied the orthomolecular medicine approach, or was that later?
No, they were older than me, but I heard of them before I went to medical school and through medical school and thereafter. So they were. I'm 66 now. They're at least 20 years older, I think.
Yes. Okay, so 1988, you have the diploma in your hand. Did you already know what you want to do with it?
Yes, I went to medical school with a specific intent of becoming a specialist in nutritional medicine and being able to put out that shingle to tell people you don't have to be sick. You can get totally well from diabetes. You can reverse it. You can get rid of your high blood pressure, not be on medications the rest of your life. You can reverse heart disease. You can get well from asthma. We can recover from lupus and fibromyalgia and psoriasis and rheumatoid arthritis. And I had people coming to me from all over the world with serious illnesses. And I pursued a residency in family practice because I wanted to be able to be qualified to see people of all ages, the elderly and children as well. And I even did some surgery, and I did minor skin surgery. I did sports medicine. I did stress tests. I did flexible sigmoidoscopies. I did a lot of dermatologic work. I was a family practitioner who did everything. I really had, and people would come to me from all over the place who wanted my natural-oriented style of medicine. But mostly, I would see more sick people and more serious cases than most family doctors would see, because they really were hoping that they would use me as, I would get them well.
To be a family physician, I believe you have to do something special after the medical exam, residency or something like that in a hospital?
Yes, it was 3 years of residency in a hospital. Yes, it was 3 years of residency and further training to be because family physician is a specialty in the United States, and you have 3 years of specialty training and then a board certification exam. And then to remain board certified as a family doctor, you have to be recertified and keep taking exams, every 5 or 10 years. I think it was in the olden days, it was 10 anyway. But so in other words, we have to be recertified and retaking exams. We don't just stay back from when we're first passed the exam in 1991. We don't stay that way. You've got to keep being tested to make sure you're current and updated with all that knowledge.
So born in 1953, you could retire. Are you still taking those exams?
Yes, I'm still board certified and maintain my certification as a family doctor.
Okay, now that hospital was in New York?
Yes, the hospital with my residency was in New York, that's correct.
And then how did the starting point for your practice in New Jersey begin? Did you have connections for the rooms, for the buildings, for the staff? How did it all start in New Jersey?
It's funny because nobody's asked me these questions on an interview before. Pretty interesting. Well, I went out, I was deciding where to live and where to open the practice up, and I came out to visit this area. My wife had her sister lived out here in New Jersey in this Hunterdon County, and it was a very beautiful area with lakes and some, outside of the city, an hour away from New York City. And I thought it was a very nice area. So I went to the hospital administrator to talk to him. And I told the hospital the type of family practice I wanted to do, be a little bit different, more natural. And he said, that will be great for this area. And we would love to have you move here and be part of our hospital system. And we can refer you patients. And so he said, I will lend you money at a very low interest rate. So the local hospital lent me, I think, $250,000 to come out here and build my practice and get the rooms built and the equipment and to design it and to get started. And it would have also money I could live off of while I was building the practice and getting it put together and hiring the right people. So the hospital in New Jersey where I started my practice definitely helped me get started on this road financially.
And you had hospital rights there?
Absolutely, yes. I worked in the hospital as well. And I also worked with some nursing homes too to make extra money while my practice was building. When I first started out, I would take some jobs taking care of nursing homes in the area.
Is that the same practice as today, or did you move from the first place to another one?
I moved from that place.
Okay.
But now obviously I still have a practice in Flemington, New Jersey that my associate, Dr. Benson, sees the patients there. And I've moved out to San Diego and seeing patients here who come into my retreat, but I still have that practice open in Jersey that has my name on it, that he's seeing, that Dr. Benson is using my methods and the same techniques to see patients there.
So you're building up a new practice in New Jersey with the help of the hospital. Patients come in, you get successful, patients get better because you have the right approach. Nutritarian lifestyle, in the point of view we have in Hannover in our Bürgertreff Gesundheit, it's the only lifestyle really working. All the other diets, McDougall, Esselstyn, Ornish, they're all very nice, but they're all missing something. And the Nutritarian lifestyle you are propagating is the thing we propagate. The first book was published in 2003, I believe, Eat to Live, right?
No. I wrote a book called Fasting and Eating for Health, published in 1996.
Oh, that's the first book. Okay. Okay. 1988, 3 years residency. 1991, 5 years later, the first book. How did you got the motivation? Building a practice, seeing patients, it's filling a job. And writing a book is work on itself. How did you do that?
You're right. It's about 60 hours a week seeing patients in those days because it was very difficult, to obviously have people come from far distances and have to give them extra time. And, they're very complicated patients. You can't give them a 5-minute visit. So I was working around evenings and weekends, and I would write the book. And, and people would then, people would think you're into some crazy thing, and they would just view you as being strange and like, so I thought it's important that I write down what I'm doing in a book and reference it with scientific information so people wouldn't think about what my views are and wouldn't make judgments that are not true, but really know what I stand for and write it in a book so that people could understand it fully. And so that was my first book, Fasting and Eating for Health.
And how was the reception? Was it a bestseller like your other books?
No, definitely not. My first best-selling book was definitely Eat to Live.
And that's the one here, Eat to Live. That's in the German edition. You have a wonderful wonderful way of editing your books in German. The cover is very nice and they're all alike. And now, 1996, the first book, and 2003, this book.
Correct.
Why did you have the motivation to write another book, not knowing whether it would be a better success than the first one?
Well, when I wrote that first book, the publisher, I hadn't written a book before, so you had to get a book publisher to accept your manuscript and want to publish your book. And they influenced me and then almost into writing a book about fasting. They wanted the book about fasting.
Oh,
they
okay.
said, no books about fasting. I had wanted to write a book about getting healthy, and they wanted me to write a book about fasting, and that's what they gave me. So I wrote that book, Fasting and Eating for Health, that emphasized fasting. But I always wanted to write a book that emphasized eating and how to eat for great health. And as you're researching one book, you're deciding which research to include in the book and what references to include there. And it helps you look, when you're looking at the scientific literature, like when I'm writing a book, I might have 400 references in there, but it means I reviewed maybe 4,000 references to pick out those 400. And then, but those extra few thousand, I have which ones might be useful for another book, but not for this book. And that's really what I formulated my thinking about this idea of nutrient density and how critical that was, and design and really incorporated that in the preliminary booklet that then became Eat to Live. And then because there was so much research on Eat to Live, on how the diet influence early in life is so powerful, causing cancer, even before you're born, even the way your mother eats food, and all that research that I generated in reviewing 10,000 studies to write Eat to Live, that I wanted my next book to be Disease-Proof Your Child, using a lot of the research I collected and that I discarded and couldn't incorporate in Eat to Live, but I can now make in another book because it was so important information I was so wanted to get out. Do you follow what I'm saying?
So you mentioned that it was important that not only see the patient for 7 minutes, which is a normal span of time for normal doctors today, which is rather ridiculous. In my country, in my town here in Hannover, for example, a functional medicine doctor needs about 60 minutes at least. When you started your career in New Jersey, how long was the time you spent with a single patient? An hour or more?
60 minutes.
60 minutes. What was your same? Now, the practice grows, the staff grows, I suppose. You're getting bigger and larger with your practice. You move to another place. How many people did you employ in the first place and then in the second?
Well, don't forget a lot of the, when I first started out in practice, in those days I was accepting a lot of different insurance people to get patients. And sometimes people, it wasn't all 1 hour visits. Some people were coming to see me who weren't actually there for this nutritional reason, and the insurance payers would only pay you $20 for the visit. And
right.
It was very difficult to make a living, and still is in lifestyle medicine, because they don't pay you for a 60-minute visit. So I did have a lot of employees to handle paperwork and insurance fees and submitting bills to insurance companies, because I was trying to start out with this type of practice. So I probably had like 8 employees, because I had office managers, 2 receptionists, some people that just worked on billing, a nurse, and so working 40 hours a week wouldn't have even covered my expenses. I had to work like 60 to 70 hours a week to even to make some extra money so you could live on. It wasn't that easy. You know what I mean? When you spend time with patients even too, when people come from a long way to see you, you can't just give them a short visit.
And the last time you were practicing in New Jersey, how many people did you employ then before you moved to San Diego?
Oh, don't forget, in New Jersey, I don't just have a medical practice. I have a staff of people where we're producing booklets,
yes,
videos, food, sauces. I make soups in Tetra Packs. So I have a food scientist. I have a research PhD. I have graphics designers. I have people I have people who are shipping stuff out of our shipping center, shipping out supplements out of our warehouse. So I have probably more than 30 people who are on my staff.
So basically from 8 people to 30 or 40 people.
Yes.
That's quite a success. Okay, if you compare yourself to the other people in the business of lifestyle, for example, Joe Mercola in Florida, or Professor Ornish, Professor Esselstyn, and people like that, did you meet those people?
I think I've met all those people, yes.
And McDougall especially, you had a nice interview, a rather recent one with Dr. John McDougall, which was rather amazing for me because I knew the history of YouTube, which was not that nice all the time, right?
Well, I don't know. I think people blow things up out of proportion. I'm actually friends with Dr. Ornish. I
Yes.
think very highly of Dr. Ornish, and I think very highly of certain people in this field that I think are great individuals, and we communicate. You know.
How do you explain that all these people, Ornish, Esselstyn, McDougall, however, from Nathan Pritikin starting, how do you explain that the movement of lifestyle medicine is sort of diverse? They are not united. How do you explain that?
You know, I hate to say it, but you know,
Are they all narcissistic egos? Except
I
you,
think
of course.
I do think that there's a tremendous amount of ego involved. I don't know how to say it in another way, but I think when people come to some position, they're reticent to change their ideas. If they're famous for it, they get published in a book, and they're reticent to change, and they hold on to these things that are already disproven, might be harmful, and they're still trying to protect it. But not Dr. Ornish, by the way.
No,
He's very open.
yes, I know.
He's modified his viewpoints, and had communicated with him, and he even put nuts back in his diets to a degree, you know.
Yes,
So
he did.
he likes to talk about, he seems open to change and to be considering some new research, but that's why I'm saying I'd like to have friendships with other lifestyle medicine doctors. I have friendships with many scores of them, and even if we don't agree on everything, we can talk about and share research and talk about the evidence and review the science, and very often they can be convinced, or, you know, so I think there's a lot of great camaraderie there. But you're right, some people don't want to discuss anything, they don't want to review the evidence, they don't want to consider it. They have a very black and white viewpoint, and it's almost shocking how little they know about the other side of the evidence that shows otherwise, and how unfamiliar they are with the studies on that sometimes. So it seems that there is a degree of ego, I think, that it is a very, very powerful effect at people limiting their vision.
I find it rather strange to understand that considering the fact that the lifestyle medicine is in an open declared war with the orthodox medical school and the pharmaceutical companies and the food processing companies and industries, that's a real war. And if you study the story of Dr. Max Gerson and the American Medical Association, that's really going even to poisoning some people of this lifestyle medicine. I find it strange that people don't realize in a war, you have to fight the enemy and not your friend.
Yeah, you're right. It's there's got to be, and I think the American College of Lifestyle Medicine has done an excellent job in bringing people together and putting a unified front, and now has a board certification exam, and to the best they can, they've incorporated a lot of these ideas and formulated it in a way that make it so people can can feel they're supported by a legitimate organization without getting that can take on the conventional medical authorities in a way that's saying, here's a new medical specialty. This is the specialty of lifestyle medicine. We're encouraging people to get sleep, get exercise, remove emotional stress, mindfulness, to be able to eat healthfully, and all these things play such an important role. And I think that there's definitely some benefit. It's not all negative. There's a lot of tremendous positive, and there's only a few negative characters out there who have a loud voice, who give the impression that things are negative, and not all the camaraderie and care we have for each other and how we're working in a community to further the practice of lifestyle medicine. I think that's a little bit ignored here.
After your success with Eat to Live, that was a bestseller. a bestseller on the New York Times list, I believe. Do you have any information how many books were printed of this first book of yours from 2003 up to now, even with the paperback edition?
I'm not sure, but I know they've sold millions. Probably, I'm guessing about 2 million books.
Okay, so we have 2 million readers, and the books is not only one reader, it's a lot, so we could probably calculate 5 to 10 million readers of the first book. What's the motivation for the second book, which was what?
Well, Eat to Live was my second book, don't forget.
Oh, yeah, okay. The second bestseller book, okay.
That's my first best-selling book.
Yes, the Eat to
My
Live
next
was...
book after that was not a best-selling book, but it was a book dear to my heart that I love, and that was called Disease Proof Your Child after Eat to Live. Remember,
okay.
I was,
that
I think it's a very important book, but it never became a bestseller.
Okay. And then the third book, the second best-selling book, was the cookbook, or was it the diabetes?
Which came first, End of Diabetes or the Eat to Live cookbook? Those were both New York Times bestsellers, yes.
Okay. So the cookbook is this one in German. Did you write it yourself, or did you have sort of a ghostwriting help with all your other duties?
No, I never had any ghostwriting help with any of my books, except for the fact that I've had some great people contribute recipes to some of my cookbooks. So I didn't write every recipe myself, but all the writing part. But I do have a tremendous staff, and I have a PhD researcher named Dina Ferrari on my staff, who helps me pull research and write some parts of my some information, sends it over to me on certain subjects. I ask her to research. She looks it up. She searches it for me. She's been my research assistant for many years, and I have. And in my book Fast Food Genocide, which was a recently written book, I had a specialist.
This one.
Yes, I had a man, Bob Phillips, who helped me write that book because he also did research for me in going historical and going back into the history of Black Americans and civil rights and the movement of pellagra. He pulled a lot of great research that I included in that book. So I had some help with writing that book. But other than basically Dina and Bob with that last book, I've written most everything myself.
So basically, when you write books, you work like a tenure professor. You have your people researching, and then writing is the professor's work. So one could say in writing the books, you're sort of a professor.
I think that's about right, yes.
So the next book after the cookbook, which one was that?
Probably The End of Diabetes or the Eat to Live cookbook, and then of course The End of Heart Disease. Oh, no, it wasn't that. It was Superimmunity was next.
Superimmunity. What's about this superimmunity?
That's a book that's current today. Even the fact that I even predicted in that book that the COVID, this idea that viruses would attack a lot of people who do immunosuppression for eating poorly across the world, was even discussed in that book, and the ability of viruses to infect and cause damage in unhealthy eaters. I discussed in that book Superimmunity. There it is, right there.
That's this one.
And then of course came The End of Diabetes and The End of Heart Disease after that book.
The Superimmunity book is a rather relevant book for today. If you're talking about COVID, the Superimmunity was published in 2012 and in German in 2013, I suppose. Would you say if the CDC had read your book, we wouldn't have the problem?
Absolutely. Well, I don't know if they just read it, but if people put it into action, we wouldn't have had this problem. It's absolutely, COVID deaths are absolutely related to improper nutrition and to the fact that people are in bad health to eating unhealthfully. And the fact that we have so much obesity, so much diabetes, so much high blood pressure, hypertension, immunosuppression, autoimmune conditions, and people just, even young, apparently thinner, healthy looking people are not healthy on the inside because they're still eating fast food and processed foods and their diet is just not healthy enough. And I insist that we would not have even any problem here with COVID if you're really healthy.
How do we explain that? Since 2012, there's a book on the market. I believe it was a bestseller, right?
Yes, Superimmunity, I think, was a bestseller.
We have a bestseller book. We have journalists. We have physicians. We have patients, and we have government. And the Trump administration especially Mr. Fauci, has never mentioned your approach. How do you explain that?
Isn't it crazy? I mean, the fact that no one talks about eating right, and it's not socially and politically acceptable, I guess. And everything is geared towards the not just the drug industry, but the food manufacturers and the food industry. It's all commercially. It's the lobbyists and the food industry and the drug industry controls what politicians do and how it's almost like you can't expect conventional governments or conventional institutional authorities to come out and tell it to people straight, because they're so influenced by who's supporting them financially, I would think.
I take this book from last year in German, Fast Food Genocide. One of your hypotheses in this fast food genocide book is that fast food is responsible for not being able to think clear. Could you elaborate on that?
Absolutely. And today, it used to be 1 in 100 Americans used to be mentally ill. Now it's 1 in 5. And the point is that I'm suggesting that the high levels of glucose from high glycemic carbohydrates and sweets damages the brain. Being overweight and in poor circulation damages the brain. And eating and lack of phytonutrients and antioxidants prevents the brain from working adequately. It's not just fatty acid imbalances, though that plays a role too, but nutritional insufficiencies play an important role in how we think in our personalities. And when you become a food addict, like when you're a cocaine addict, you can steal and cheat and hurt people to get your cocaine. But the more you're an addict, and the more you're involved narcissistically with meeting your own addictive drives, and you're less of a giving and feeling and person with gratitude and goodwill for humanity and passion for helping other people, I think it makes you more narrowly concerned. And most people, they live to make some money so they can go and imbibe in alcohol and dangerous foods. They live for their food. And it makes them absolutely less creative and less compassionate and less mindful of the world. So I'm definitely, and can set the stage for depression. That we say that the scientific evidence to show that the consumption of commercial baked goods like pizza and white bread and croissants and bagels and donuts and cookies and fast food, fried food, and is linked to depression in a dose-dependent manner. Even 2 servings a week doubles your lifetime risk. But as you go up to more servings a week of these empty calorie, these empty nutrient foods, your risk of developing depression increases. But it's not just depression. People become dysthymic and they're not excited and not happy. They're not depressed, but most people become just not too thrilled about living and just live to imbibe in stimulating substances.
And I believe there's also an argument that violence gets more with fast food.
Yes, definitely. And there's also, we saw that in human history. After the Civil War in the United States, we had an epidemic of pellagra due to niacin deficiency in the southern in the southern part of the United States, where there was an epidemic of pellagra where people had what medical doctors called a causal necklace, which was a layperson called it a red neck, and people became aggressive, angry, violent, homicidal, suicidal. That was a factor in the aggression and the lynching of blacks who are now free, who became freed. But there was a definite backlash, and the growth of the white supremacy movement, and this movement of seeing people as different genetically instead of all similar, started from these people after the Civil War in the 1800s and early 1900s, and then eventually, gave birth to the white supremacy movement in Germany. So it really started here and then moved over to Germany, and of course.
Yes, the Nazis made copy and paste of the Jim Crow laws, and that was the Nuremberg laws. That is a story many people don't know. If you look at the research of the pellagra disease in the south of the United States, it took about 35 years before the the knowledge, which was the cause for the problem, got into sort of acceptance. Is that typical for medicine, that it takes, for example, the Semmelweis story with washing your hands for birth-giving mothers, that took 50 years before they started washing their hands. Is that typical for your profession, outside yourself, of course, that good knowledge takes 50 years before it's applied in the profession? Is that your experience, that it takes very long? Research is out there. Vitamin D, for example, for COVID is out there. Do we have to wait 50 years before we apply the vitamin C infusions and the vitamin D levels for the COVID problem?
Well, I think that today it's not taking, maybe we can get things done quicker. I think more and more people obviously are realizing the importance of good nutrition, but it's still a small segment of the population. We have, like, as we have more people becoming obese and getting sick, but we also have a growing segment of people getting healthy as well. So the information is out there and people can make a choice to reject it and continue with their addictive habits, or they can look and learn more. And I think many people are exposed to this. I've been on public television in the United States and exposed this way of thinking to millions of people in America. And they have a choice. And but most often, these people don't choose to live healthfully. They might have some exposure to this, some knowledge of this lifestyle. But the attraction of eating junk food and fried food and fast food is just too great for so many people. They just rather continue abusing themselves and eating themselves to death.
And the way I got to know you is when you were a star a supporting actor, one would say in the Hollywood terminology. You were a supporting actor, a star in the movie Fat, Sick and Nearly Dead. And that was when I got to know about you. And after that movie, we bought a juicer and bought your books and founded the Bürgertreff Gesundheit in Hannover. How did that come about? Joe Cross was living in Australia. Did he write to you from Australia, or did he contact you in New York when he was there already?
I think he was in New York and he contacted me and asked to be part of this project. And
okay.
So I think he was in New York, not from Australia, but he told me he came from Australia, of course.
What was your first thinking? I don't want to do this fasting thing for 60 days. I think that's too much probably. Or did you think it was a good idea from the start?
No, I thought it was not a good idea.
Okay.
And I always thought that his emphasis on the juicing wouldn't give people enough information about what to do after they finish juicing. You know what I mean? Which is obviously the case.
Yes.
But nevertheless, I was still supportive of the whole project because I thought it would be good to show people that diseases like that could be reversed, at least open their eyes up to show them that you don't have to be sick with an autoimmune disease for the rest of your life. Because the conventional message from the medical profession is, you're sick with an autoimmune disease, and he had autoimmune urticaria.
Yes.
And the people with lupus and psoriasis, and I'm getting all these people well again and seeing them recover again. And I knew he could get well. But every doctor is telling people you can't get well, you have to be on drugs forever, and these drugs cause cancer, but you have to be on the medications, or you have to go through kidney transplants and be on dangerous drugs. Famous people have gone through kidney transplants rather than change their diet. It's just crazy. So I definitely wanted to be part of something that would encourage people to learn about good nutrition, even if it was just juicing. And certainly I can help contribute to the formulation of that movie with the science to support his cartoons and his explanation of how cells work and how they need nutrients. So I definitely played a large role in development of that movie.
Did you see Phil Staples, or was that outside your participation?
I did meet Phil and Bear after the movie, not during the movie was filming, but I saw them at some point. And they, of course, gained the weight back. And
yes, I know.
Because I'm still trying to impress on them that they have to study and learn the science of this Nutritarian lifestyle and stay with this long term, and not just use juicing and go back to conventional eating after that.
No, Phil Staples is portrayed in the second movie, and it's rather a tragic story, because if he would have listened to your Nutritarian lifestyle, he wouldn't have had that tragic story. So do you remember did Joe Cross ever tell you how he came about for green juice? He could have done water fasting, but he did know about fasting in general. Did anybody recommend the 60 green juice fasting, or was that something he invented by himself? Did he tell you that story?
I don't remember it. I know that he was dead set in doing a long fast.
Oh, okay. And he was green juicing from the beginning. He didn't want to do water fasting, and you didn't.
No, he never would consider water fasting or fasting that long with a water fast. But I said I would monitor his safety if he wanted to try to fast.
Yes. Okay, that's the Joe Cross story. Thanks for the input there. So Super Immunity, a book anybody should read if he wants to discuss COVID discussions and if he wants to discuss whether Fauci is corrupt, stupid, or insane. I leave it to the watchers, to people who see this movie. After Super Immunity, what's the next book?
I think the series of the books that the end of diabetes, the end of dieting, the end of heart disease. I started a series of books called The End of.
The end of heart disease, the end of dieting, and that's a special.
It was first The End of Diabetes was the first one.
This one, The End of Diabetes.
The End of Diabetes was the first one. I think then came Super Immunity, or I'm not sure the order of those two. And then it obviously came The End of Heart Disease, The End of Dieting.
What was the motivation for this series of books?
Well, I wanted to cover some of these major topics, because people, go into them more depth. There's just so much information and so much misinformation. I felt I had to add my voice to this world, that discussion, especially with regard to the end of diabetes and the end of heart disease. They're getting all types of information that's not 100% accurate. And I wanted to show people the preponderance of evidence, and they could feel confident that this information is so well supported by the scientific literature, and where maybe what they're thinking or what they've been led to believe has been wrong.
So were they all bestsellers?
The End of Diabetes, The End of Heart Disease, The End of Dieting, I think they were all bestsellers. I've had 7 New York Times bestsellers, that's correct.
So we are talking about millions and millions of books printed and sold and read probably. So Dr. Joel Fuhrman is a one-man show influencing the society.
Not millions and millions, but millions. Certainly, several millions books were sold.
Yes. What's your impression from the feedback? Well, you see patients all the time, but then you have feedback on your homepage. There is a membership possibility for people who are not patients of yours, I believe. How many members are in contact with your mission?
Oh, I don't know. My
wife, is it a large number?
Staff would know that. What's that?
Is that a large number?
Yeah, there is a large number of people, but the reason I have that members site too is that I started years ago after Eat to Live, because I'd get like 100 emails a day of people asking me the same questions over and over again.
Yes.
And I couldn't answer the same question in 20 different emails over and over again. I'd be up day and night. So I opened the center. So if I answered it once, people could join and they could see the answers, and they could read somebody else asking me the same question. And they could ask me their question and I could answer, and everybody could read the answer, because the answers to the questions are educational and informative. And people love to read the answers of other people's questions. So I developed the Member Center predominantly as a way for me to communicate with my audience and efficient use of my time, so I won't be answering the same question about flax seeds 40 different times in a row. You know what I mean?
Yes. So in 2017, I believe this book was published in English, and in 2018 in German. That's a different type of book. There must have been a special motivation to write this rather politically important book, because that's in political science relevant. The other books are nutritional lifestyle, sort of medicine books, healthy for health, but fast food genocide is in its core a political statement, right?
It's still up my alley in nutritional science and statements that are supported by science, but it goes back into, I don't consider it political as much as historical.
Okay.
Going back into history and showing how we got here with so many people obese, sickly, confused, and not doing and dropping dead of mental illness and committing suicide and genetically weakened, and why we developed with so many sick people, with a healthcare crisis, going back in history to describe this. And this food movement gets wrapped up with the historical development of the United States and the modern world and the modern medical profession. And I can't go into all of it. I just chose that part of it, some segments of it that I felt were important and interesting. But there's much more to tell than even that, as you can imagine. But I felt it was of tremendous interest, and I thought it would be a very popular book. And I think people would love reading it because it's really a very interesting read, and they would learn a lot, motivate them to eat healthfully and change their diet. And I was wrong, because this book does not sell or did not become a New York Times bestseller.
Well, there is reason for that. It's rather, for the leftist Marxists in your country, it's not a good book that it exists, because your book shows cause and effect. And there's a very special chapter which goes right into the heart of the Afro-American problem in your country, the race problem. Could you elaborate on that chapter?
Yes. Well, I go back into history to a degree, and I say that, and I explain how this idea that Black Americans are inferior mentally and physically and have higher rate of diabetes and depression and prostate cancer and all these problems, that it's not true. That after the Civil War, when these newly freed slaves, the Black Americans, were able to get their access to vegetables and farm their own food and make beans and collards and broccoli and things, and eat healthfully, there were more long-lived Black Americans in the South than there were white Americans. They had more centenarians among that population, and they generally were not sickly. And then with the Jim Crow laws and the collaborate and the hookworm and the more violence being created, driving many Black people north away from the violent South, and going into cities, coincided with the development of the fast food and processed food movement and less access to produce, that then started to create these problems that actually can become genetic to a degree, because we can eat unhealthfully and pass on. Our eggs are in our side of us before they're, for a woman in her childhood has the eggs of her children right inside her body. And if she's eating unhealthfully, she can have a child that's born with autism and fast food and all other degrees, not autistic, but other degrees of problems. So I'm suggesting that any problem on a particular group of people can be traced back to their poor nutrition either in themselves or in their parents or grandparents. And I showed how bad nutrition for generations can affect disease and outcome and success in life and economic success. And so we're saying here that we're all genetically more similar than we thought, and we're not. And the most important thing that determines our ability to be happy and healthy and our full mental faculties and our intelligence and success has to do with the foods we're fed. And all through our life and even before we're born affects that as well. And if we believe that all people are created equal and have an equal right to health and happiness and well-being and economic success, then we have to people should have the opportunity to eat healthfully if they choose to. And we have to have people the opportunity to eat real healthy food, including vegetables and beans and nuts, to be able for humans to fully develop. So there's a political issue there. And I even showed that when an effort is made to feed people better, you have better outcomes. And the Black community in the United States, when they're taught and this is visualized and explained to them, they can make decisions to improve their health, and they do. You see better health outcomes as a result of that. So we have to see things differently, and we have to help. We're all interconnected and should be interconnected to help each other, and to help each other with better nutrition, which down the road will have profound beneficial effects on society.
When the book was published, Fast Food Genocide, did you get a reception feedback from the Black community?
No, not really.
How do you explain that?
Well, I think that there's nobody, it's up to you to promote your own book. I mean, nobody does it for you,
Yeah, but if the book is there and it's of such importance for a special group, the Black American community, and it gives an insight what should be done educationally for a better lifestyle to give the black community the possibility to live the American dream, which they can't today because of their bad nutritional lifestyle.
Correct.
One would think that somebody reads that book who is black, Afro-American, and thinks about doing something about it. So nobody wants to do something about it?
No, that has definitely happened. There are people who are expounding my work and utilize my book in churches and in black communities. And there's
okay, so there's a reception in the black community.
That has absolutely happened. Yes.
Okay, so in that time, shortly before the book appeared, you had a special experience in Florida. Do you want to tell the story?
A special experience where?
In Florida. Investors and a clinic.
Oh yes, I wanted to start a retreat there, but I was approached by people who wanted to do a retreat with me in Florida, and we started it, but it wasn't. But you know, with the other people kind of like operating it, I wasn't there, and I couldn't operate the way I wanted to. But the doctor I hired to run it was terrific, and we did some good work there. But it was not. It was not viable economically and run properly. So I pulled myself out of it, and then eventually opened up my own retreat in San Diego, where I wouldn't have other people controlling it with me. So I'd have only me owning it. It was much more better to do it the way I want to do it. You know what I mean?
So basically, you had an experience with Florida, which made you see the fact that the best way to do something is without anybody else, because you are the chieftain there. Some people are employed, but you decide everything, right?
That's right. That's correct. But it didn't work with partners who were doing things in a way that was not going to work well, and they were too. You know what I mean? There was too many things being done improperly that I could not fix.
So basically, when I did this interview trailer, and I was talking in the trailer about the Eat to Live retreat in San Diego, it's a very nice place. I understand it has only rooms for 7 patients. Is that right?
Well, we've had 2 houses, but the one house that's going to be the main retreat, we're still finishing construction on. So eventually, should have 16. It eventually will have 16 rooms. No, 7, 12. Yes, it'll eventually have 16 rooms.
So 16 people can come there for.
No, but a lot of the rooms have 2 people in them, like husband and wife, or people that come together.
Okay.
So it could have up to 20 people here.
Okay. Basically, this is an offer for people who are sick to become healthy again, and instead of dying of diabetes, becoming 19 and 100. So your Nutritarian lifestyle basically is sort of, a way to become old and not suffering. Is that a proper definition of what you're doing?
I think so, but also don't forget, a lot of people are having a relationship with food that's an addictive relationship, and they know they should eat healthy and they can't do it. And getting away from that food and staying here for a while and getting the psychological training and the emotional training here we give them can help them learn to enjoy eating this way. They learn the great recipes with our chefs, and they can go home and they can replicate what we do here and stick with the diet better. So for a lot of people, it's not knowledge, it's compliance, and they just can't seem to comply with it until they spend some time learning it better. And also abstinence from their addictive triggers that they can't stop eating these foods they shouldn't be eating. So that helps them leave here. So sometimes people just come in because they're overweight and can't stick to it well. And when they leave here, they can comply with it and continue to leave and continue to lose weight and get benefit from it. So I'm saying is that and also some people are coming here just to reverse their diseases, like psoriasis or lupus or something, that are just not just to live longer, but just to get well and to get better.
The Max Gerson therapy for cancer patients in the terminal stage need 24 months before they are healthy again. What's your vision? How long should, if the money is there and the will is there, the discipline is there, is 12 weeks sufficient, which you recommend, or should it be more than 12 weeks?
It depends on the individual, I understand that in some cases, the more time, the better. Some people we found take 6 months to their taste buds are retrained sufficiently to love this diet better than their old diet. But 3 months is a good stay for most people. And that's where a lot of drug addiction centers and cocaine rehab centers go to the 3-month level. And so we feel the same way, that 90 days is usually enough, because at that point, their personality has changed. They're appreciating what they're eating. Their taste has changed a lot. They've learned the recipes. They've got the knowledge. And they're going to usually be successful if set out on their own accord and control of their own life.
So if you have a patient a few days before operation on the operating table for heart disease, for stents or open surgery, he goes instead comes to your Eat to Live retreat in San Diego, and he gets well again. Is that possible in 12 weeks?
Oh, yeah.
Okay.
There was a person there's some people who came right from the hospital after a heart attack, who told they need bypass surgery or stent placement, refused it, came right out here. And some of these people, and I'm thinking of a man who came from Nashville, Tennessee, who I think he stayed here for just 2 months. And I think he lost maybe 40 pounds while he was here, but he went home, lost another 40 pounds. We dropped 80 pounds, but he could hardly walk when he first came here. But the time he left, he was walking up the hills and walking miles and doing great. He never had angioplasty or bypass surgery. It's amazing when you do things so properly, how quickly the body can reverse some things. It's just amazing how.
You are living on the ground there?
Yes.
And are you still sometimes going to New Jersey, or is this now your new task for the next 30, 40 years? Because you're 67 now, I believe?
No, 66.
66. So considering that the Nutritarian lifestyle, if followed with discipline and consequence, 100%, normally these people become 95 to 105 years old. So you have another 30, 40 years to work. Is that what you want to do? 30 to 40 years work in that retreat?
Well, I'm going to be living here. I have my property right next to the retreat property, so I'm planning to live out my life here. But okay. I don't know how much I work at the retreat. It'll be up to me. I mean, my daughter is finishing naturopathics, is going to naturopathics.
Oh, okay.
I have
you have options to do something different for the next 30 years.
Yeah, maybe my daughter's going to do most of the work here, not me. You know what I mean?
Okay. So any plans what you will do?
Besides play tennis and go surfing and climb mountains and go skiing and read books and garden and raise vegetables and put fruit trees and just do whatever I do, so I'm going to enjoy life and still work.
Okay. So for the last question, we were talking about Nutritarian lifestyle, which works to get very old without any diseases. In our work for the unpaid telephone coaching, we recommend not only to read your book and follow your Nutritarian lifestyle, we do something on the orthomolecular side. We recommend this. Is that something you would disagree or say that's okay? Vitamin A, 1600 milligrams per day, not bad. Vitamin B complex, high dose. Vitamin C, more than 5,000 milligrams. Vitamin D, more than 50,000 or 10,000 international units. Vitamin K2, MK7, more than 200 micrograms. Zinc, above 25 well, at COVID times might be 50 milligrams. Magnesium citrate, above 600 milligrams. Selene, in Germany, because of the depletion of the soil, 200 micrograms.
Yodora. Every number, but I could just say right now that my only problem, my major problem with this is vitamin A. I'm concerned about.
Yes, okay. So that's the only one you would have a problem with.
Yes, vitamin A is.
So let's come to the last question. Dr. Joel Fuhrman personally, following his Nutritarian lifestyle, sort of following in the footsteps of Shelton, Nathan Pritikin, and with a very sophisticated science behind it. What supplements do you take personally every day?
Well, I take my men's multi, which has extra K2 and zinc and iodine and B12 and vitamin D. It has those extra to optimize the levels of those nutrients that you don't get in the diet. And I also take a separate algae-derived EPA and DHA.
Yes.
DHA. And I also been taking that extra mixed mushroom extract that I make called Immune Biotech, and a little extra the turmeric and the green tea extract. I just take it. I think it's probably helpful. but so I'm taking those extra supplements with the mixed mushrooms, the astragalus, the beta-glucan, the turmeric, and the green tea extract, in addition to the basic ones I used to always recommend, taking a little extra there.
So basically, we following in your footsteps, being the embassy of Nutritarian lifestyle of Dr. Joel Fuhrman in Hannover, Germany, we are basically recommending the right things. Last question, do you do blood work for your vitamin D every year?
Do I do my own blood work on me?
Vitamin D, yes.
I don't think every year, but I've done it on occasion, you know.
Is there what level are you aiming at? Is it more than 60 nanograms or is it 100 nanograms per milliliter?
No, in the United States, the levels are different. The numbers are in a different range. I think the normal range here is between 30 and 60.
Yes, but that's not scientific anymore. That's just rubbish. The modern science on vitamin D says you have to be above 60 nanograms, and some people say it's a good idea to have 80 to 100. What's your personal?
No, you didn't hear what I said. I'm saying it's not nanograms per milliliter. It's a different scale here.
It's nanomole per liter.
Yeah, it's a different scale. So what might be
that's
80 to 100 there might be 40 to 50 here. I'm saying it's the different scale.
Okay, if you're measuring in nanomoles per liter, that's 16 nanograms would be 150 nanomoles per liter.
Right. So it's different.
Yes. What's your personal aim? Where do you want to be every year with the vitamin D level, which is important because it's very important for the gene regulation in the body.
Right. So I generally want to be in that normal range between 30 and 60.
Oh, okay. Well,
that's I don't know, where does that correlate with your levels with numbers on the scale, different scale? Is that 80? Yeah. What's the number?
Well, the number in Germany, the Raimund von Helden and in the interview with Professor Hollis from South Carolina, basically are saying you should have more than 60 nanograms per milliliter, which is 150 nanomoles per liter.
Oh, I see.
You should have more than that. So basically you're...
I'm familiar with his work, but I don't recommend that high levels that he does.
Not that much. Yeah. Anything I missed to ask you? Any important question other people have asked you I did not? And I should ask?
Well, no, you went over a lot, but there's always some tweaking and modification to the program you have to do for individuals with some serious illnesses like ulcerative colitis or rheumatoid arthritis. So there's some modification and tweaking we do. I don't give one fixed dietary program for every person. I try to adjust it accordingly to help them. And there's always some things that we can do, like you're saying, even something supplementally, we could help people with depression or digestive disorders. There's always, so I'm not just fixated on one, you could say one robotic application of one method for everybody. We sometimes have to modify some things to help individuals get better.
Okay, so we will talk after I stopped the recording a little bit. So for the moment, very many thanks to Dr. Joel Fuhrman in San Diego, California for this wonderful interview. And for the viewers, herzlichen Dank fürs Vorbeischauen und auf bald.